Glaucoma is called a silent thief of sight. But do you know that some babies are born with it, and that some people develop it without even feeling any symptoms? Hello everyone, welcome to my channel Clear Vision Chronicle, where we break down eye health in a way that is simple and easy to understand. In the last video, we talked about the hidden journey of fluid. In today's video, we'll be shedding light on glaucoma types you must know to protect your eyes. We will dive deeper into the types, the management, treatment, and lots more. So stay to the end of this video. If you are new here, don't forget to subscribe so you don't miss any important updates on your vision. Alright, let's break it down. Like I said in my last video, glaucoma is an ocular syndrome characterized by raised intraocular pressure, cupping of the disc, and visual field defects. Glaucoma is like a silent thief of the sight. Yes. Therefore, it does not show any symptoms in early stages, but over time, the damage can lead to irreversible visual loss. So, understanding IOP and its connection to glaucoma is essential for early detection and prevention. We have various classifications of glaucoma. We have the congenital developmental glaucoma, and then we have the acquired glaucoma. Under the acquired glaucoma, we have the primary glaucoma and the secondary glaucoma. But in today's video, we'll be talking about the primary glaucoma and the congenital glaucoma, while in my next video we'll talk about the secondary glaucoma. So stay tuned and don't miss it. What then is congenital developmental glaucoma? These are a group of diverse disorders in which abnormal high IOP occurs, and this is due to developmental abnormalities of angle of anterior chamber. This congenital developmental glaucoma is classified into two types. We have the primary congenital glaucoma, and then we have the secondary congenital glaucoma. The primary congenital glaucoma is not associated with anomalies, and it is further divided into three. We have the true congenital glaucoma. The IOP is elevated during intrauterine life. Then we have the infantile glaucoma. Here it manifests prior to the age of 3 years. And then we have the juvenile glaucoma. The IOP raises between the age of 3 to 16 years. The secondary congenital glaucoma is associated with anomalies like aphakia, aniridia, trauma, entropion lentis syndrome, phacomatosis, and intraocular inflammations. Let's now talk about the primary glaucoma. This primary glaucoma is diverse, but is largely divided into two: the primary open-angle glaucoma and the primary closure glaucoma. The primary open-angle glaucoma is also known as the chronic simple glaucoma. It is a chronic progressive optic neuropathy of adult onset. It is characterized by open angle of normal appearance, optic disc cupping. Its predisposing factor and risk factors include intraocular pressure increase, common risk factor of primary open-angle glaucoma. Next is age. This starts from 40 years and above. The third one is family history, diabetes mellitus. The fifth one is myopes. The sixth one is retinal diseases. We have thyroid disorder, cigarette smoking. It is more common in blacks than in whites. Primary open-angle glaucoma affects about 1 in 1,000 of general population of either sex from 40 years and above. It forms about 1/3 of all glaucoma cases. Clinical features of primary open-angle glaucoma. Primary open-angle glaucoma is normally asymptomatic until it has caused a significant loss of visual field. Frequent change in presbyopic glasses are seen. Mild headache and eye ache. Visual field defect. Delayed dark adaptation. Pupil reflex becomes sluggish. Haze cornea, sprintal hemorrhage, pallor area, large cup disc which is greater than 0.4 ratio. Optic nerve head appears white and deeply excavated. Peripheral visual field defect. The investigation and diagnostic tests are: 1. The tonometry to check the IOP. 2. The gonioscopy to view the angle. 3. The perimetry to detect visual field defects. 4. Slit lamp examination. to rule out causes of secondary open-angle glaucoma. 5. Fundus examination to document optic disc changes. The goals of open-angle glaucoma treatment is to prevent the progression of optic nerve head change. 2. To prevent deterioration of visual field. And 3. To lower intraocular pressure. We have medical therapy which can help in the treatment of open-angle glaucoma. They include the anti-glaucoma drugs, surgery, laser trabeculoplasty. But that is not all. The open-angle glaucoma is actually of two forms, the ocular hypertension and normal tension glaucoma. Yes, so let's break them down. The ocular hypertension is a condition that is characterized by raising intraocular pressure. No evidence of optic nerve damage, no visual field defect, no systemic or ocular cause for raising intraocular pressure, but has an open angles. It is associated with some risk factors like elevated IOP, thin cornea, increased age, vertical cupping of optic nerve, family history, systemic factors like diabetes mellitus, disc hemorrhage. Ocular hypertension can actually be treated by regular eye test for patients with low risk. 2. Use of anti-glaucoma drugs like prostaglandin, beta blockers, adrenergic drugs. It is also called the low tension glaucoma. It is a form of open-angle glaucoma which is characterized by glaucomatous optic neuropathy, visual field defect, open angles with intraocular pressure that is less than or equal to 21 mm mercury. Its symptoms include reduced vision, loss of peripheral vision, pupil dilation, headache, swollen cornea, while its signs include intraocular pressure which is low or equal to 21 mm mercury, optic disc change, peripapillary atrophy, thinning of neuroretinal change. It mostly affects elderly people who are of 50 years and above, especially in males. And for the treatment, it can be treated using beta blockers, latanoprost, brimonidine, and then it can be treated surgically using laser trabeculoplasty, full thickness filtering surgery, drainage implant surgery, minimal inversion glaucoma surgery, cyclodestructive procedures. Now let's talk about the primary angle closure glaucoma. It will be our last class for today. The primary angle closure glaucoma, this occurs due to obstruction in flow of aqueous humor through the anterior chamber angle, preventing its drainage through the trabecular meshwork. Angle closure glaucoma is the major cause of blindness worldwide, especially in Asian countries. It is characterized by increase in IOP, which can lead to visual field defect if untreated, and this is due to optic nerve damage. For the predisposing factor and risk factor, we have the anatomic factor, the general factor, and precipitating factors. For anatomic factors, we have the hyperopic eye, the iris lens diaphragm placed anteriorly, the narrow angle of anterior chamber, the plateau iris configuration. For the general factor, we have age, which is above 50 years, sex, it is more in female than in male, and more in Southeast Asia. For its precipitating factors, we have dim illumination, emotional stress. Its clinical features include redness of the eye ache, headache, vomiting, blurred vision, colored arrows, reduced VA, raised in intraocular pressure, circumcorneal congestion, corneal edema, and hazy cornea. Let's talk about the epidemiology of this primary angle closure glaucoma. According to International Society for Geographical and Epidemiological Ophthalmology, the epidemiology of primary angle closure glaucoma is divided into 3 stages. We have the primary angle closure suspect, the primary angle closure, and primary angle closure glaucoma. For the primary angle closure suspect, The narrow anterior chamber is present, no elevated intraocular pressure, but there is optic nerve damage and peripheral anterior synechia. It is mostly common in Asian, and this is due to the shallow anterior chamber. But in primary angle closure, there is presence of narrow anterior chamber angles with evidence of elevated intraocular pressure and peripheral anterior chamber synechia with no optic nerve damage. It mostly affects women than men. In the primary angle closure glaucoma, there is narrow anterior chamber angles, optic nerve damage, and corresponding visual field loss. For the diagnostic test, this can be tested using tonometry, gonioscopy, slit lamp, ultrasonic, fundoscopy, and visual field analysis. So what is the takeaway? Congenital glaucoma happens at birth and needs early treatment and surgery, while primary glaucoma develops later in life and can go unnoticed for years. Both can cause blindness if not treated on time. Did you learn something new today? Let me know in the comments. And if you find this video helpful, don't forget to like, share, and subscribe. It could help someone protect their sight. In the next video, we'll be talking about secondary glaucoma, a type that happens due to anomalies. I know you don't want to miss it, so hit the subscribe button and turn on notification. Until the next time, take care of your eyes and see the world clearly with Clear Vision Chronicle. Bye.